Hello, in the last video we talked about the biological effects of the radiations on the human body, and in this chapter we'll read specifically about the oral effects of the radiations. Oral effects can be classified into acute effects and the chronic effects. This we have already studied in detail in previous videos. These include dysgeusia, mucositis, xerostomia, sialadenitis. And in chronic effect includes osteoradionecrosis, fibrosis and trismus, salivary gland hypofunction, radiation caries. And development effect on the tooth is also there in radiation dose which is more than 30 grays. Now we'll read about all the effects of radiations on the oral tissues one by one, starting with the radiation induced mucositis. The oral mucosa contains a basal layer of composed, rapidly dividing radiosensitive progenitor cells. By the end of the second week of radiation therapy, the cell death induces an inflammatory response and the mucous membrane begins to show areas of redness and inflammation, which is known as mucositis. In the second picture, we can see that during the therapy, the irradiated mucous membrane separates from the underlying connective tissue and forms a white to yellow pseudomembrane, which is nothing but a desquamated epithelial layers. At the end of the therapy, the mucositis is usually the most severe, discomfort is at the maximum, and the food intake is very difficult. Given here is a WHO oral toxicity scale for grading the mucositis. Grade 1 is the least involved mucositis, and followed by grade 1, grade 2 and grade 4, which is the severe form of the radiation induced mucositis. Radiation induced mucositis typically occurs 1 to 2 weeks after the start of the radiation therapy. Symptoms may persist for the duration of the radiation treatment and gradually resolves after the therapy concludes. And near about it takes 2 months for healing of radiation induced mucositis. Pain management is utmost important while we deal with the radiation induced mucositis. Pain management includes the topical anesthetic, using the gels or the mouth rinses with agent like lidocaine to numb the affected area. Systemic analgesics, over the counter pain relievers like acetaminophen or the ibuprofen can also be given to alleviate the discomfort. Oral care should be practiced, including the soft bristle toothbrush, mild toothpaste. Rinses should be saline or the baking solution, or the medicated rinses can be prescribed. Hydration is very important. These patients to stay hydrated and to drink a lot of fluids to keep the mucous membrane moist. Humidifiers may be used to keep the air moist. Dietary adjustments are also made, which include the soft diet. Bland food should be eaten by the patient, and the food consistency should be such that it should be less likely to irritate the mucosa. And the patient should be advised to steer clear of the spicy, acidic or rough textured food. Salivary glands are highly sensitive to radiation, and therefore the damage of the acinar cells of the salivary gland can lead to a condition of dry mouth, which is known as xerostomia. And this condition can lead to difficulties in speaking, swallowing, and there is also an increased risk of dental decay. Management includes a salivary substitute which mimic the natural saliva to keep the mouth moist, and it also relieves the discomfort. Salivary stimulants can be given to the patient. These are the medications of the product that stimulate the remaining salivary glands to produce more saliva, like pilocarpine, sugar-free gum or lozenges. Regular sipping of water and oral rehydration solution should be advised to the patient to keep the surfaces moist and to help maintain the moisture in the mouth. Fluoride gels, varnishes, and the toothpaste should be advised to the patient so that the tooth are protected from the decay due to reduced salivary flow. Radiations may reduce the taste sensations. The patient may have the altered taste sensations, which may be unpleasant, or the metallic taste may be in the mouth. There may be the loss of the appetite due to decreased interest in eating due to taste changes. Includes adding a strong flavors of the seasoning to make the food more enjoyable, maintaining a good oral hygiene to avoid infections and irritation. The diet can be modified to include appealing textures and the flavors, and the patient should be advised to ensure adequate fluid intake to maintain the oral moisture. Radiation may cause inflammation and fibrosis of the muscles, resulting in contracture and trismus in the muscles of mastication. The masseter muscle and pterygoid muscle are usually involved. Restriction in the mouth opening usually starts approximately 2 months after the radiotherapy is completed and progresses thereafter. Exercise for the mouth opening are helpful to minimize the trismus. Osteoradionecrosis is a late complication of radiation therapy, and it occurs when an area of irradiated bone becomes devitalized. It is a serious condition that can occur as a complication of the radiation therapy, particularly when it is used to treat the cancers in head and neck region. And this topic we will discuss in detail in the coming videos, because it is very important topic from the examination point of view. Irradiated patients are at increased risk for development of rapid rampant caries process, which is known as radiation caries. Caries frequently become severe in the cervical and incisal edges of the teeth, and if they are left untreated, they can progress rapidly to involve the pulp. Reduced saliva and possible mucosal damage, there is an increased risk of oral infection, which include fungal infections like thrush. The table given here, it describes the summary of the oral effects of radiation on the oral cavity. You may pause the video here and take a snapshot. Thank you. This was all about the effects of radiations on the oral cavity. Hope you like my video. Please subscribe to my channel and keep hearing and learning always. Thank you. Thank you so much.